Determining the best antibiotics for racing pigeons. Racing pigeons are bred for speed, endurance, and homing ability. However, like any animal, they are susceptible to bacterial, fungal, and parasitic infections. Having the right antibiotics on hand is key to promptly treating sick birds and avoiding large outbreaks in the loft. There are several factors that go into choosing the most appropriate antibiotic. Respiratory infections. Respiratory illnesses are very common in pigeons. The nasal passages, sinuses, trachea, and air sacs can all become infected. Causative agents include chlamydia. Chlamydia psittaci is a bacterial species that causes nasal discharge, sinusitis, and air sac infections. It can spread quickly between birds. Mycoplasma, Mycoplasma gallisepticum, and M. synoviae also infect the respiratory tract. Swollen sinuses and foamy eye discharge are common symptoms. Streptococcus. Streptococcus species lead to sinusitis, conjunctivitis, and pneumonia. Escherichia coli. E. coli causes ersicolitis and generalized infections. The best antibiotic choices against these respiratory pathogens include doxycycline, a tetracycline antibiotic that treats chlamydia and Mycoplasma spp. It is administered in drinking water. Tylosin, a macrolide drug, often sold as Tylen, that is effective for Mycoplasma. Given in water. Amoxicillin, a broad-spectrum penicillin active against Streptococcus, E. coli, and other gram-positives and gram-negatives. Given orally or by injection. Enrofloxacin, a fluoroquinolone antibiotic called Baytril that works against Mycoplasma and chlamydia. Given in water. Gastrointestinal infections. Diarrhea and intestinal upset are common in pigeons. This can lead to dehydration, malnutrition, and poor racing performance. Common causes include Salmonella, Salmonella typhimurium, and S. enteritidis are prevalent bacterial causes of diarrhea. E. coli, highly pathogenic forms like E. coli 086 can quickly cause fatal systemic illness. Campylobacter, Campylobacter jejuni infects the gut and causes diarrhea, loss of appetite, and lethargy. Antibiotics that penetrate the GI tract well include enrofloxacin, fluoroquinolone that is effective against Salmonella spp. Doxycycline, in addition to respiratory activity, doxycycline treats common diarrheal pathogens. Trimethoprim sulfa, the combination drug binds bacterial enzymes systemically and in the intestines. Neomycin, poorly absorbed aminoglycoside that treats gut infections by E. coli, Campylobacter, and Salmonella. Wound infections. Lacerations, punctures, and abscesses are prone to infection. These often require both topical and systemic antibiotic therapy. Cephalexin, a first-generation cephalosporin used to treat skin and soft tissue wounds. Amoxicillin clavulanate, an oral penicillin/beta-lactamase inhibitor combination that penetrates wounds. Enrofloxacin, effective against Pseudomonas, staph, and other bacteria that infect wounds. Factors in choosing an antibiotic. There are several factors avian veterinarians consider when selecting the optimal antibiotic. Bacterial culture and sensitivity, identifying the causative bacteria and their antibiotic susceptibility profile guides treatment. Site of infection, drugs that attain high levels systemically versus in certain tissues or body fluids are chosen accordingly. Owner compliance, selecting antibiotics that are feasibly administered by the owner influences prescription. Cost, expense, availability, and insurance coverage affects decisions. Generics are preferred when possible. Side effects, drugs that cause minimal adverse effects like gastrointestinal upset are favored. Drug interactions, ensuring no negative interactions with other medications birds receive is crucial. Resistance patterns, choosing antibiotics that remain efficacious against bacteria in the region helps mitigate resistance. Withdrawal time, antibiotics used close to races require appropriate withdrawal times to avoid positive drug tests. Proper use of antibiotics. To ensure the best outcomes when treating with antibiotics. Use as directed, follow the dose, duration, and method of administration. Do not stop early or underdose. Ensure full water consumption. When giving antibiotics in water, monitor intake to ensure full doses are ingested. Separate sick birds, isolate infected birds to avoid spread of disease. Disinfect the loft after treatment. Finish the course, even if birds look better, continue the full course to prevent recurring infection. Combine topical and systemic. For wounds, use both topical disinfectants/antibiotics along with oral or injectable antibiotics. Seek veterinary guidance. Consult an avian vet when possible for culture and sensitivity testing. The array of antibiotics available equips avian veterinarians to effectively treat ill racing pigeons. However, Judicious use based on bacterial isolates, patient factors and owner compliance helps ensure the best outcomes. Establishing a relationship with a knowledgeable veterinarian provides helpful guidance in choosing the right antibiotic therapy when needed. There are many reasons to buy my racing pigeon method. Here are some of the best reasons. You will get excellent results. It's a very simple system to use. It's affordable. I have had over 400 first prize winners. It's adaptable to any situation. You can use it with any racing method, natural, widowhood, young birds. It's a very effective method. There is no need to spend a lot of money on fancy pigeon products. It's a reliable system and it is foolproof to use. Professional athletes, race horses, take the same products. There is science behind this, not just hearsay. It is all to do with red blood cells and oxygen in the blood. Without that, a pigeon will not race well, or an athlete will not win a race. If he has low oxygen in his blood, the above is fact and is 100% science. There are a few things you can do to improve your chances of winning at racing pigeons. One of the most important things is to learn as much as you can about the sport. You'll need to know the different types of pigeons, how to train them, and how to race them. Another key factor is practice. You'll need to be able to fly your pigeons competently in order to win races. And, of course, you'll need to have the funds to invest in racing pigeons and other racing equipment.